Hi again, I'm Mabel Jong, and you're watching the World Healthcare Congress Interview Zone. Thank you so much for joining us. In my studio right now, we have David Berg, who is president and co-founder of Redirect Health. Mr. Berg has over 20 years of healthcare leadership, and your company is a very unique model. Tell me about it.
So we created Redirect Health because nobody else would do it.
Okay.
Basically, so I have a healthcare company today. I had one years ago with quite a few employees, and we were doing the traditional things of going out there to provide health insurance for our employees, and we just could not find anything where the math worked, where we could afford it, and our employees could afford the deductibles and co-pays, et cetera, and the rules were burdensome, and so we couldn't figure out how to make it work for our entry-level people. We could make it work for our doctors and for our managers, but for 3/4 of our business were entry-level people at that time, and we couldn't make it work. So I created something on my own, and it worked so well that I kept it secret because I had a huge competitive advantage when it came to hiring people. Where my competitors might be able to get 10 resumes, I would be able to get 400.
What was the attraction? What is the secret sauce?
Because I figured out how to get healthcare so inexpensive that I could advertise for the job with free healthcare.
Oh, wow. Okay.
And I could spend less on my healthcare than my competitors could, and I could charge my employees nothing at the same time. And then
how were you able to do that?
Well, because I'm in the healthcare business, I recognize that there's a lot of waste. There's a lot of things that happen in healthcare that don't need to happen. There's a lot of paperwork that happens that doesn't need to happen. And any one of us, if we knew it and we were able to not buy those things, wouldn't buy it.
Okay. Be a little bit more specific about how you're able to really shop for healthcare that is really under.
So I don't even think it's really shopping, Mabel. It's more about just knowing what the fair price is.
Okay.
So if I know that the cost of an MRI, so if we go back to 2007 when I started doing this, the range in cost of MRI was about in Phoenix. It was about $380 to about $2,000. That's my memory. It's a big range. So if I knew how to get the MRI for $380, I'd have a competitive advantage, don't I?
Yes, absolutely.
I thought the $380 was healthcare. Everything above that was waste to me. So I knew how to avoid that waste. Now today, that $380, 11 years later, is about $250. So the cost of an MRI has come down. But that $2,000 has now, I've seen as high as $6. Right, so the gap is bigger. So today, the cost of an MRI is $250. The amount we add above it, to me, is waste or something else. I don't know what you want to call it, but I don't call it healthcare. So I just learned how to pay the right amount for things. It's not even about negotiating. You don't have to negotiate when you know the fair price. You only really have to negotiate if you don't know what it is. We just go the fair price, and we have a way of paying for it. Similarly, we've seen that babies can cost $21,000 in one hospital, delivered by the same doctor, and another hospital costs $4,000.
And by the same doctor?
Same doctor. So huge differentials in pricing all over the place. And this was really radical to know this in 2007.
Yes, to realize
but when I started writing
my
own checks, I mean, any entrepreneur who writes their own checks figures it out pretty fast.
Sure.
Now the hard part is now how do you put it into a system that's executable and operational, and you can get it down to the entry-level person. But in its essence, all I did is I figured out how to stop paying those excessive prices and paying for the paperwork and the administration and the audits and the recoups that went around that and the legal that went around that, and just got rid of things. Again, exponential simplicity is what I call it. I don't add things to make things better. I get rid of irritating, annoying things, wasteful things, expensive things, administrative things, and then get the cost so low because all that remains is the valuable things of healthcare.
Okay.
And then,
but how do companies in other states outside of Phoenix replicate what you've done? I mean, I think that your company has been nominated for a number of awards, the Health Value Awards that we're presenting tonight. They're going to want to know how you were able to do this, specifically, the kinds of things that need to be in place.
So, Mabel, the very first thing I tell every business owner, and the entrepreneurial business owners get it right away. The more corporate type business owners, they don't get it as fast. Entrepreneurs understand the importance of mindset as the driving force. Before how do you do it, it's about how do you think about it. So the people, all of our clients for the most part who are attracted to us, they are hungry, they're craving to think about this differently. So let's talk about how we think about it traditionally today. Let's go buy some insurance. And let's go figure out how to get the employer to subsidize it so that more people can afford it.
Okay.
So that it forces participation, encourages participation through encouraged employer contribution. But it starts with the insurance. To me, that's a little bit like getting a Rolls Royce and saying, how can we strip things out of it? How can we get rid of the fancy stitching? How can we get rid of leather seats? How can we get rid of that engine so that it's more affordable for somebody making $10 an hour to drive it? It's a hard thing. Similar, how do you take a $1,000 platinum insurance plan and make it so it works for an entry-level person making $10, $15 an hour, which is over half of our workforce in America, by the way. So how do you do that? The answer is you can't. You can raise deductibles, but you only get to about 50%, and then even those people are the people who are going bankrupt because of healthcare costs. They can't afford the out-of-pockets. But they never gets down to the low-wage worker. So what I did is I flipped it, and all our clients do this too. We start with, how can we provide the thought, the mindset? How can we provide meaningful access to healthcare for our most entry-level person in a company? Where you work, that entry-level person is a little different than at a car wash. Right? So let's say that we go to a car wash in Phoenix that pays $10.50 an hour. Many of the people that work there, their first language is Spanish.
Okay.
So and that's 90% of the workforce. What's meaningful access to those people? Well, it better be in Spanish. It better not have $25 copays. It better not have $6,000 deductibles. And guess what? It can't even happen during business hours when the sun's out, because that's when people are washing their cars, and they can't afford to miss an hour or two of a paycheck and still make their rent.
Right.
See, so meaningful access for that business is different than in a law office or a doctor's or somewhere else. So we start with that, and we make sure there's no waste, no administration. We make sure we can take care of them over the phone at 3 in the morning in Spanish. We make sure there's no cost associated with that. But because we don't allow the waste into that system for the entry-level access to health care, there's a lot of money freed up now, lots of it freed up. And then we add the pieces to it, the insurance pieces that we need for the middle wage manager and the higher wage, maybe executive in that whatever company it is. But we free up a lot of money that can then be applied for the whole company.
And you're customizing it to meet the specific
so
needs
when most people,
groups.
including me, before 2007, they start with, okay, what do I need for my family and my key people, doctors in my situation, I own a healthcare company, and my managers, and then how do I try to figure out how to get it for my receptionist and my janitor and medical records people? I could never get there. I could pay a lot of money, but I could never get there to a point where they could afford the out-of-pockets or even the time off work. When I flipped it in 2007, starting in 2008, and I said, okay, I'm going to build something for them first, and then I'm going to add what I need to support my managers, my doctors, our executives. It became remarkably easier. Still hard, but what it wasn't impossible now.
Okay.
So we turn what was impossible, going this direction, into something that's just hard this way. And now we've done it thousands of times, so it's easy now for us to do. But we're miles ahead of others, not because of what we do, but because how we think about the problem.
Does the model work for companies of all sizes? Because you're talking about many different levels of employees in a company. So it sounds like it's a bigger mid-sized to large company.
Yeah. So it has less to do with the size of the company, it has everything to do with the mindset of the decision maker. So our biggest right now is I think 800 or 900. Our smallest is 2. I've seen some companies with 20 people who the mindset's not there. And here's how I know the mindset's not there. Hey, I just need cheaper insurance for my family. I don't care about everyone else. In a 20-person company, that's not a good client for us. I've seen 800 people that says, hey, I've got 700 people that make under $15 an hour, and my work comp costs killing me. I've got to figure out how to get first dollar coverage to these people so we can meaningfully take care of them so they're not using my workers' comp and destroying my business and my profits. That's a great client. So nothing to do with size. It has everything to do with the mindset of the decision maker. And a business owner that says, that's not my job, that's HR's job, I don't want to think about it, also not a good client, because that's somebody who thinks the system still can work for their company. And I'm not saying it can't work for their company, I just say, I don't know how to make the math work, but apparently they do.
Okay, we're going to hear more from you after the awards ceremony tonight. But let me ask you: this is your time at the World Healthcare Congress. What are you getting out of it so far?
So I mentioned to you earlier that I kept a secret for a couple of years when I discovered this way of thinking and getting rid of, just destroying, eliminating in an exponential way the waste and the paperwork, the administration that costs a lot of money. I kept it secret. And part of it is because nobody really wanted to listen to it.
Okay.
And it was offensive to some people that I was trying to think differently.
Okay.
And also because I had a great competitive advantage when I did it in my business.
Right.
And there's a part of me that said, is this really legal? Why is nobody else doing this?
Right.
But I knew it was the right thing to do.
Okay.
But I didn't have the time or money or the wherewithal to even check the laws or how to find out. And then when the recession happened, I helped my friends who are in business do it.
Okay.
But there's a lot of loneliness, to get to your question. There's a lot of loneliness in trying to figure it out. What I love about this group is there's a whole bunch of minds right now that have been thinking the same things that I've been thinking for the last 11 years. Some people are jumping in the last year.
Okay.
Other people were here 20 years ago thinking this way. But it solves that problem of loneliness that slows down innovative, original thinking.
Okay.
And I know hanging out with people like Dave Chase and David Contorno, I mean, they add nuances to my thinking that if I had known these things 10 years ago, I'd be 20 years ahead right now. Okay. So coming together and sharing nuances is extremely valuable. I know when I look at my slide deck that I present on, I mean, one of the things I want to do here is I got to find Dave Chase so I can thank him for giving me the information in my slide deck and somewhat get permission to use his information in my slide deck.
All right.
Because there's a collaboration that only happens when people are face to face that doesn't happen in email or Facebook or LinkedIn. We think it is, but there's something a little different about this.
All right. David Berg, thank you so much for your time today. Really appreciate it.
Thank you.
And I'm Mabel Jong. Stay tuned. More to come.